So today I will be demonstrating how to administer an NG tube feeding and how to administer an enema. I'm going to start with the NG tube feeding. First, obviously, I would identify my patient, perform a hand hygiene, put on gloves. I would also review the patient's chart for any allergies and to also review the healthcare provider's order for the tube feeding. So this is my NG tube. Obviously the tube would be inserted into the patient. I would make sure that my patient is sitting in the Fowler's position at least 30 to 45 degrees. Before I can administer the feeding, I have to check the gastric residual volume. So I'm going to take my syringe, insert it into the tube, and pull out the gastric contents. So here I've got 60 cc's of gastric contents, but there could be more in the stomach. So I'm going to clamp this off, remove the syringe, and put the contents into this cup. Now I'm going to put the syringe back into the tubing, unclamp it, and remove any more gastric content from the stomach. So this time I had about 40 cc's of content. So 60 plus 40 is about 100 cc's of gastric residual volume in this patient's stomach. I'm going to put the 40 cc's back into the patient. I'm going to clamp it, remove the syringe, and get the 60 cc's back out of the cup. I'm going to insert it again, unclamp, and put the rest of the gastric contents back into the patient. Alright, clamp it and remove this. Now I'm going to prepare my formula. If for some reason there was more than 500 milliliters of gastric residual volume, we would notify our healthcare provider. But for this patient, there was not, so we're going to continue with the feeding. I've prepared my formula with the correct strength and amount, and I have my water here. They're both the correct temperature, amount, strength, everything according to the order. I'm going to remove my plunger from my syringe. I'm going to clamp this off so that no air gets in. Insert the syringe into the tubing. So I'm going to start with my formula. I'm going to pour my formula about halfway up and let it go. And as it starts to get low, I'm going to continue to pour my formula into the syringe until there's none left in my cup. And once it starts to get low in the syringe, I'm going to clamp it off and flush it out with water. So I'm going to do the same thing with the water that I did with the formula. I'm going to put some water in there, let the tubing go, and keep filling it up with water until I run out. And then I'm going to clamp it off. I'm going to remove my syringe, stick this back in. I'm going to tell my patient that they need to stay elevated for at least 30 minutes, but it's recommended that they stay up for about an hour. Then I would document my procedure and my findings, and that's all I have to do for that patient. Excuse me. Now, for the enema, I would, perform my hand hygiene, put on my gloves, identify my patient. I've got all of my equipment here that I will need. So I will first make sure my tubing is clamped, which it is. I'm going to prepare my solution. So I would take like some lukewarm water and put the designated amount of water into the bag. I would then take my soap, pour my soap in, and when you are mixing it, you want to do it gently. You do not want to form bubbles in the bag. So you do it gently and mix it all up. I would then put on my gloves. I have them on. And I would roll my patient over to their left side and have them flex their right knee. I would place some padding underneath my patient because it can get a bit messy. I would want to make sure I had some thorough, thicker pads just in case. So after I get my patient rolled, I'm going to make sure this is lubricated. I am going to spread my patient's buttocks to be able to see the anus. Once I do that, I will ask them to inhale slowly and deeply, and as they do, I'm going to insert my enema towards the umbilicus for about 3 to 4 inches up. Once it is inserted, I will make sure my bag is hung with one hand, and I will unclamp it with the other hand so that it can start running. When you hold it up about 18 inches above the buttocks, now if they start cramping or complain of some uncomfortable feelings that they have going on, you can lower your bag to reduce the amount to slow it down, because gravity helps you out. So depending on how fast or slow you want it to be going through the tube, you can move it up or down. So when you are removing it, well, you will obviously let this all run out. You'll clamp it back. You will remove it, and you will ask the patient to try to hold it in for as long as they can. Then you will document your findings.